Let's take it from the other way around now and talk about some of the positive influences, ways we can support the mitochondria and hopefully prevent cancer or fight cancer if somebody's in the boat where they already have cancer. And I know for you, the biggest lever in this realm is you've touched on diet and more specifically, the ketogenic diet. So let's talk about why this is so pro for the mitochondria.
So when we eat a ketogenic diet, we are significantly ratcheting down our glucose in the system. So we're eating very little carbohydrate, which is broken down into glucose, which can then stimulate insulin. So now not only are we bringing down glucose, we are bringing down insulin. So what has been shown in numerous trials is women or men, depending on the study looked at, but those who have higher insulin levels have higher risks of recurrence, have higher risks of metastatic disease, have higher disease stages at the time of diagnosis. So what we know is that if we have lower levels, those things are not as bad. There's actually data, yes, even in humans, we know we don't seem to hear about it very much, but even some small studies looking at humans putting cancer patients on ketogenic diets, or maybe not what is typically known as a ketogenic diet, but other fasting mimicking diets, because there is some distinction out there, although really the bottom line is getting a person into a metabolic state that is creating ketones. So any fasting mimicking diet, in my opinion, is a ketogenic diet. But that being said, in these studies, it seems that the therapies are significantly augmented. Even stage 4 patients who maybe aren't expecting any big drama, they're just so there's stage 4 colon cancer patients that were put on ketogenic diets or standard of care. And those patients on the ketogenic diet in stage 4 that really just were getting chemotherapy, it was kind of palliative chemotherapy, so they weren't expecting any cures. And I'm not saying that any patients were cured, but the response rates were dramatically better in the ketogenic diet. In fact, 50% of those patients had complete responses to the diet with their standard of care palliative chemotherapy versus standard diet and chemotherapy. And in the standard diet group, 0 patients had complete responses. Now, some of them had partial responses, which is great, but the power of adding that. So why is that? When we feed our normal cells ketogenic diets, they operate just fine. They can operate any which way we want to do it. And we're keeping them healthier by not bathing them in high glucose states. But very interestingly, when we follow a formulated ketogenic diet, so we're not saying bad fats like those seed oils and salad dressings and mayonnaises typically at most grocery stores, but really optimizing the natural fats that come in our animals and maybe some olive oil or coconut oil or other, I always say fruit oils as opposed to vegetable, nut, and seed oils. But when we optimize those foods, we're not bathing our healthy mitochondria in toxins. We're removing a lot of those foods that create the problem to begin with. And because those cancer cells have damaged mitochondria and they need more glucose, they need that insulin signaling for growth, we're taking that away, or we're keeping it extremely limited. So now we're taking away, and we will always have glucose in our system and we will always have insulin. So when we say we're starving cancer, we can't shut it off completely. We need it to live, but can we make those cells so fragile now that our therapies work so much better because those cells are so ready now to be killed by whatever therapies we want to use, whether that's conventional therapies or other oxidative stressors to those cells. We can really enhance that effect when we put the stress on those cancer cells, take away their preferred fuel, or at least ratchet it so far down that, and when we're burning fatty acids, we're shutting that, even though there is some glucose and insulin in the system, we're actually shutting it down further.
Is there any research comparing fasting in that case with traditional chemotherapy versus a ketogenic diet, which is a fasting mimicking diet. But I'm just curious on the nuance.
I wish. No. So really all studies at this point, at least the ones that I can find, are either there's a chemotherapy trial with water fasting. There's chemotherapy trials with severe calorie restriction fasting. And because those are not sustainable, they were only doing them around the chemotherapy. So a day or 2 or 3 or 4 around that dose of chemotherapy. The beauty of a ketogenic diet, right, is that we get into a fasted mimicking state. Sometimes we can make it. We can do a little calorie restriction or fasting around our chemotherapy, but we can then continue it day in and day out for our entire course of therapy. Maybe we're going to stay in a ketogenic state for 6 months or a year. Some of us, many, many, many years. I wish that we were looking more closely, but right now, I just wish that the conventional world was even looking at this Warburg idea more robustly. I know people in the research world, and I will bring it up. Hey, why don't we do a study? Oh, there's just not enough data on that yet. What? I think there's so much data and really so much pathophysiology that we can say, but this should really benefit a patient. Like why? And I work with patients every day, and most of the time, the next day they're like, oh my gosh, I feel so much better. It's like within days, they're like a light switch has flipped and I finally feel great, even though I know I still have cancer. Just my energy level is better. My joints are better. Like they're already feeling better. And I lost that extra 30 pounds of fat mass that I had right in my belly, so that you can see people get healthier. So I don't know why there's such the resistance in most conventional medical offices when we're talking about diet and cancer. Most of the time it's don't lose weight while you're going through therapy. And I know why they say that, but don't lose weight while you're going through therapy. Don't do that crazy ketogenic diet. You're going to, have a heart attack or something. Yikes. So anyway, it's just a lot of misinformation. And I think that the step one is really, can we get them to start incorporating these techniques into cancer therapies? And then we can get into the nuances of looking at water fasting versus calorie restriction versus ketogenic diets. And my guess is that a ketogenic diet will win only because you can do it for the entire course.
All right. So to summarize here, when we use one of these different modalities that's going to improve our metabolic health, it's going to improve conventional chemotherapy. You mentioned patients will generally feel better. And then a little bit of nuance on that. I've heard that if you do, I think this might just be for fasting, and you can clarify it might be keto as well. But when somebody incorporates that around chemotherapy, they can feel a lot better during treatment. So if they start that beforehand, fast throughout the chemo, and then afterwards, that can help with the symptoms of chemo.
Yes, definitely. So the trials that have looked at that have either used water fasting or severe calorie restriction fasting around chemotherapy, and those patients tolerated chemotherapy better. In fact, in the fasting mimicking or the restricted calorie diet, the patients didn't even take the steroids that are usually given in conjunction with chemotherapy, which then, of course, drive up sugar and insulin. So those patients that were doing the fasting mimicking diet did not have steroids and still had better overall symptom scores. The one that was using water fasting in gynecologic malignancies, they had less need for dose reductions. They had less hospitalization. So definitely can help protect in that state, right? If we think about it, right, we're going to take away that preferred fuel for the cancer cell, but we're still providing the preferred fuel. Now, when we're fasting or using calorie restriction for fasting mimicking, what we're doing is we're pulling fuel for our normal cells from ourselves. We're pulling it from body fat. So we're still eating but we're eating ourselves. And that may be okay for some. But sometimes we do have quite cachectic patients. That means very little fat and maybe even little muscle, that they've already eaten a lot of themselves. And so in those patients, I find that using water fasting or calorie restriction wouldn't necessarily be the best way to get them into a fasted mimicking state. I would much rather them be feeding their normal cells, feeding themselves good micronutrients, vitamins, minerals, amino acids, fatty acids to get them, their normal cells operating better while they're going through therapy. So again, yeah, definitely we can improve our symptoms based on the studies that are available. We can improve our outcomes based on the studies available.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
This is your body saying, hey, I finally had to throw down this really big, scary word at you so that you would stop and listen, so that you would stop and look. And so now let's just work to see what is